Mr. Speaker, I would move now to suspend the rules and pass S-330, HIV Organ Policy Equity Act.
The clerk reports the title of the bill.
Senate 330, an act to amend the Public Health Service Act to establish safeguards and standards of quality for research and transplantation of organs infected with the human immunodeficiency virus, HIV.
Pursuant to the rule, the gentleman from Michigan, Mr. Upton, and the gentlewoman from California, Ms. Capps, will each control 20 minutes. The chair recognizes the gentleman from Michigan.
And I would ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and insert extraneous materials in the record on the bill.
Without objection. So ordered.
Mr. Speaker, I yield myself such time as I may consume.
The gentleman is recognized for such time as he may consume.
Mr. Speaker, I stand in strong support of S-330, known as the HOPE Act. The HOPE Act would eliminate the restriction on acquiring HIV-positive organs in order to permit research on transplants between HIV-positive individuals. The legislation will increase the number of available organs and help all those who are awaiting a transplant. In 1984, Congress enacted the National Organ Transplant Act, NOTA. The purpose of NOTA was to guide organ donation and transplantation. And in 1988, Congress amended NOTA to ban the transplantation of HIV-infected organs. Well, today, HIV treatments have extended and improved the lives of countless HIV patients. This, in turn, has increased the need for organ donations. This bill would allow research to fully evaluate the safety and effectiveness of organ transplantation between individuals and HIV. Specifically, the bill would permit research on transplants involving HIV-positive individuals by eliminating the restriction on acquiring HIV-positive organs. The legislation also would direct the Secretary of HHS to develop and implement standards for research on the transplantation of HIV-infested organs. And finally, the bill is going to require the Secretary of HHS to revise transplant standards based on that research. H.R. 698 is the House companion to the HOPE Act. Ms. Capps authored H.R. 698, and our committee, the Energy and Commerce Committee, passed it by a voice vote last July. Earlier this year, the Senate passed the legislation before us today, which was led by Senator Boxer, Coburn, Baldwin, and Paul, bipartisan group. By passing the HOPE Act now, we will send it directly to the President so that he can sign it into law and avoid a conference. This common sense proposal has the potential to save lives. With 100,000 patients waiting for life-saving organs, permitting HIV-positive donors to be used for transplants could save as many as 1,000 HIV-infected patients every year. So tonight, we provide some hope for those in need of a new organ. I support this bill. I urge my colleagues to do the same, and I reserve the balance of my time.
The gentleman from Michigan reserves. The gentlewoman from California is recognized.
Mr. Speaker, I yield myself such time as I may consume.
The gentlelady is recognized for as much time as she may consume.
I rise in strong support of the HIV Organ Policy Equity Act, commonly known as the HOPE Act. The HOPE Act is a critical step towards improving the health and well-being of persons living with HIV and AIDS and strengthening our nation's organ transplant system. Many of us remember the fear and worry that surrounded AIDS in the 1980s. At first, no one even knew what caused AIDS, and the diagnosis was considered a swift death sentence. In that time of fear and the unknown, a blanket ban was placed on transplanting any HIV-positive organs, even for the purposes of research. However, in the last 25 years, medical research and technology has transformed HIV/AIDS care and treatment, and now, thanks to these breakthroughs, HIV is a more chronic condition. And this has led to improved life expectancies, something we can and should celebrate. But it also means that HIV-positive people are more likely to encounter medical complications as they age. They face unique complications as the powerful drugs that keep their HIV at bay often take a hard toll on their bodies, putting them at increased risk for ailments like kidney and liver disease. And for some of these problems, the only treatment is to wait on the same long waiting lists as all Americans do for an organ transplant, but there might be a better way. According to transplant experts, each year we toss out hundreds of HIV-positive organs that could be otherwise viable for transplantation into other HIV-positive people. These organs have the potential to save lives and lessen the transplant waiting list for all Americans, but instead they are wasted because of the archaic blanket ban that prohibits even the research to see if they could be used by those who already are HIV positive. And that's why we need to pass the HOPE Act today. The HOPE Act would create a pathway grounded in medical science to research the feasibility and safety of positive-to-positive organ transplantation. Think about it. This is a chance to possibly shorten the waiting list for everyone waiting for an organ, deliver better health outcomes for those in need, and lower healthcare costs by moving individuals off the dialysis rolls, all while maintaining the safety and integrity of our current organ transplantation system. That's what the HOPE Act can help and will help do. It is common sense, fiscally responsibility, and the right thing for all Americans awaiting transplants. I'd like to thank and acknowledge Senator Boxer and Senator Coburn for championing this issue in the Senate. With their leadership, the HOPE Act passed by unanimous consent in June. I also would like to thank my colleagues, especially Mr. Harris, the Republicans' lead on this bill, and also Dr. Burgess, a co-sponsor and strong supporter of this bill, for their leadership. And finally, I'd like to thank all the advocates who have worked so hard in support of this legislation. I'm pleased to stand with an incredibly broad coalition of health professionals and HIV/AIDS advocates in backing S-330. The HOPE Act is a common-sense bill that creates a path forward for research on this issue. It has strong support on both sides of the Capitol and on both sides of the aisle. It's a critically important issue. It's an opportunity to save lives. And that's why I'm urging a yes vote on S-330, the HOPE Act today. Reserve the balance of my time.
The gentleman from California reserves. Gentleman from Michigan.
Mr. Speaker, I would ask that the balance of my time be managed by Mr. Pitts. Ask unanimous
Objection.
consent.
It's order. Mr. Gentleman, Pennsylvania is recognized.
Thank you, Mr. Chairman. I yield myself such time as I may consume.
The gentleman from Pennsylvania is recognized for as much time as he may consume.
Mr. Speaker, I stand in support of another bipartisan bill this evening. The HIV Organ Policy Equity Act, or the HOPE Act, would lift a ban dating back to the 1990s on acquiring HIV-positive organs so that the Department of Health and Human Services can conduct research on the safety and effectiveness of transplants between HIV-positive individuals. As HIV treatments have advanced over the last 30 years, many HIV-positive individuals are living longer lives, but they're also more likely to experience conditions such as kidney and liver failure, which necessitate a transplant. This bill provides a potential path to a separate organ donation pool for HIV-positive organs, hopefully increasing the overall number of organs available for transplantation. The HOPE Act passed the Senate by unanimous consent in June and is supported by the American Society for Transplantation and the American Society of Transplant Surgeons, among others. I would encourage my colleagues to support this bipartisan common sense bill and would like to commend Drs. Harris, Dr. Burgess, Ms. Capps, Chairman Upton, and the ranking members Waxman and Pallone for their leadership on this bipartisan bill, and I yield back the balance of my time.
Gentleman reserve from Pennsylvania. Gentleman reserves. Gentleman from California.
Mr. Speaker, I'm pleased to yield whatever time she needs to consume to my colleague from the Washington, D.C. District, ELEANOR Holmes Norton.
The gentlewoman from Washington, D.C. is recognized for as much time as she may consume.
I thank my good friend from California, and I thank all of the bipartisan leaders of this bill, especially Ms. Capps, who has made health care a signature issue for her ever since coming to the Congress. Mr. Speaker, we haven't found our way out of one of the great disparities in medical science. The difference between the 100,000 patients seeking organ transplants and the mere 30,000 who get such transplants annually. The HOPE Act provides a possible breakthrough, one that I don't think we can refuse. And it's a breakthrough for many of those who otherwise would really, whose condition would make them hopeless in waiting for an organ transplant. The regular reviews to evaluate medical research that are mandated by this bill could allow transplants from HIV positive donors to HIV recipients. If the procedure, and this is important, the safeguards are tightly woven into this bill, if the procedure is shown to be both safe and effective, no wonder the Boxer-Coburn HOPE Act was passed by unanimous consent in the Senate. The wholesale ban in 1988 did not even allow research on HIV-infected organs. I'm not sure I understand that, since in this country we usually do not take research out of the picture. But today, medical science has come a long way, allowing many to live with HIV. We save many lives, but lose them anyway to chronic conditions such as kidney and liver damage, often caused by the very HIV medications that have saved their lives. If they go on dialysis, there is virtually no hope for a transplant today. The way out of this conundrum is the way we have understood since the Enlightenment. Look for the evidence. Who can know where the science will take us or whether it will take us anywhere? With estimates of as many as another 600 organ donors who could be helpful annually, who would not want to try to find if this could be accomplished? Again, I thank the sponsors of this bill, which I think is rightfully named the HOPE Act.
Gentlewoman yields back. The gentlewoman from California reserves. The gentleman from Pennsylvania.
Mr. Speaker, at this time I'd like to yield 2 minutes to the gentleman from Texas, the Vice Chairman of the Health Subcommittee, Dr. Burgess.
The gentleman from Texas is recognized for 2 minutes.
And I thank the Chairman for yielding. This bill before us tonight is a common sense policy that will remove some barriers in the law and ensure patients who are suffering from life-threatening illnesses can access vital treatments. We've heard the numbers discussed tonight. Over 100,000 patients currently awaiting life-saving organs. That number grows by thousands every year. Coupled with the fact that our current organ donation policies are outdated and do not reflect the most current research and clinical developments. So the bill before us tonight corrects this, allowing organs from HIV-positive donors to be transplanted into HIV-positive recipients, and this has the potential to save over 1,000 HIV-infected patients every year with liver and kidney failure. Allowing the HIV-positive donations to increases the organs that are allowing these HIV-positive donations increases the organs available to HIV-positive recipients, and more importantly, it actually grows the overall pool of organs that will be available. Further, transplant surgeons already have experience with the transplantation of infected organs. Today, surgeons perform organ transplants on patients who are infected with hepatitis C, a disease with similar transmission methods as HIV. And I would reassure my colleagues, I have taken the time to speak with transplant surgeons from the American Society of Transplant Surgeons, spoken with doctors in the National Institute of Health. This does not pose an increased health risk for the already HIV-infected patient from the recipient of an organ donated by an HIV-positive donor. But it will provide the potential for increasing the number of organs available for transplant, and anybody who works in transplant surgery knows that this is the number one issue that they face on a day-to-day basis. This legislation is sound, science-based policy, It's also good fiscal policy. It increases the options for safe transplantation, eliminating the need for patients to receive costly recurring treatments, and instead allows patients to receive viable organs to live fuller, more productive lives. I urge colleagues to vote in support of this life-saving bill. I yield back to the chairman.
The gentleman from Texas time has expired. The gentleman from Pennsylvania reserves. The gentlewoman from California.
I would ask the gentleman from Pennsylvania if he has more speakers. I'll continue to reserve.
The gentlewoman reserves. The gentleman from Pennsylvania.
Mr. Speaker, at this time I'd like to yield 2 minutes to the gentleman from Maryland, Dr. Harris, one of the leaders on this issue.
The gentleman from Maryland is recognized for 2 minutes.
Thank you very much, and I want to thank the chairman of the subcommittee for yielding time. Mr. Speaker, the HOPE Act is exactly the kind of bipartisan legislation that will improve lives and have a positive impact on our health care system. You know, as a physician for nearly 30 years who's participated and conducted medical research, I know firsthand how medical innovation often outpaces government laws and regulations. This is one such example. As an anesthesiologist, I've had the privilege of taking care of many patients for transplant surgery, and I've seen numerous times the life-saving joy that an organ transplant brings to patients and their families. The HOPE Act changes an outdated law by making government work in a more efficient and effective manner for all patients needing transplants, both those with HIV and those without, which is exactly what the American people expect from us here in Washington and from their elected officials. Mr. Speaker, it's time to move the HIV Organ Policy Equity Act, Senate 330. I want to commend the gentlelady from California for working with me to get this bill through. People are waiting for these organs, and I urge my colleagues to vote yes on Senate 330 later tonight. I yield back to time.
The gentleman from Maryland yields back. The gentleman from Pennsylvania reserves. The gentlewoman from California.
Are you prepared to close? Okay.
Gentlewoman from California.
Thank you, Mr. Speaker. Mr. Speaker, I ask unanimous consent to submit letters of support from the United Network for Organ Sharing and a coalition of health professional and HIV/AIDS advocacy organizations.
Without objection.
And I also urge my colleagues to support this important common sense legislation, and I yield back the balance of my time.
The gentlewoman yields back. The gentleman from Pennsylvania.
Mr. Speaker, I also would like to ask unanimous consent to include an exchange of letters between the Committee on Energy and Commerce and the Committee on the Judiciary on H.R. 698 and the House companion bill to S. 330.
Without objection.
With that, Mr. Speaker, I also urge support for this bipartisan common sense legislation. I yield back the balance of my time.
The gentleman from Pennsylvania yields back. The question is, will the House suspend the rules and pass Senate 330? Those in favor say aye. Those opposed, no. In the opinion of the chair, 2/3 being in the affirmative, the rules are suspended. The bill is passed, and without objection, the motion to reconsider is laid upon the table.